Audio Jungle. As Nigeria walks down to the rainy season and its negative impact of malaria caused by the Plasmodium parasite, usually transmitted through the bites of infected Anopheles mosquitoes, the World Health Organization (WHO) says it is determined to ensure the elimination of this curable infectious disease in the country. Expressing its readiness at a stakeholders' engagement on rethinking malaria elimination in Abuja, the WHO Regional Director for Africa, Dr. Matshidiso Moeti, said the fight against malaria requires more commitment from all stakeholders and pledges the organization's continuous partnership with the federal government to abate the consequences. She therefore appealed to the government to ensure it increases its data collection at all levels for citizens' access.
The important thing is how, as partners, we can work closer together, more coherently together, in a more integrated way to ease the burden on the government side of working with all of us and to make the most of the resources that we will invest. Most importantly, the population, the community has to be involved. How exactly, in what sort of quantity to use the vaccine. Certainly, the vaccine, let's emphasize, is a very important tool, but it's one of a range of tools. We must continue with the other things that are being used, the mosquito nets, the spraying, the treatment, the early diagnosis, and focusing particularly on children and pregnant women. So the vaccine will be extremely valuable. We are working with partners to introduce it as soon as possible. The government has to determine the degree to which we need to target it, where it will make the most difference, so that in an affordable way as well.
At the event, stakeholders say more work is needed for the total elimination of malaria in every Nigerian home.
Multifaceted approach is a whole of a government approach. We're involving the Ministry of Environment, the Ministry of Agric, and also Ministry of Education in our agenda to move ahead to eliminating malaria. A big part of it is use of data, and before we use data, we have to do research. There are a lot of we have abundant evidence out there.
In Africa, particularly Nigeria, the parasite malaria is often disregarded despite its life-threatening nature, which is why most wedding homes uses mosquito nets to avert the disease, while low-income earners are at the receiving end. Vincent Okushi, reporting for Quality Television. Audio Jungle.